This will be given by Dr. Avraham, or Avi for his friends, Rivkind. He's a associate professor of surgery and the head of the Division of Emergency Medicine and Shock Trauma Unit at the Department of General Surgery at the Hadassah Medical Centre in Jerusalem, Israel. He is also the chairperson of the Israel Committee on Trauma and the director of the Advanced Trauma Life Support program in Jerusalem, Israel. He's the personal physician to the late President of the State of Israel, Mr. Ezer Weizman, and an advisor to the Surgeon General of the Israel Defense Force on general surgery, trauma, and ethics. He's awarded the Karl Stroll Chair in Surgical Trauma. Ladies and gentlemen, please welcome Dr. Avraham Avi Rivkind.
First of all, thank you for the invitation. It's really a big honor for me. And unfortunately, we are not a peaceful country, as you know, and we have a lot of experience in terror activities, war, and in stabbing. Yesterday, there was 4 deaths from stabbing in Beersheba in the south, and with 2 injured patients that were stabbed. So unfortunately, we are really not a peaceful country, but we are a beautiful country, and we have what to share with the world, not only terror, war, etc. I will try to give you some really bits and pieces from our experience in Jerusalem and in Israel. And really, I choose something I think that are special to our place. When you deal with trauma, you can when you deal with terror, you should remember the basics, and you have to know the reality of the assumptions. And remember that you have to prepare for what will happen, not what should happen. And preparation requires leadership. And everything is to save life. That's the purpose. It's a daily purpose, and especially in a day of terror or war, like now the war between Ukraine and Russia. So that's our purpose in life, and that's what we have to do to save life. Next slide. Remember that it's so-called the predictable surprise. Usually, you know, people want to, the tendency is to maintain the status quo. We must learn and practice new skills, like was mentioned in the previous lecture. Problem exists that will not solve itself. Remember it. Problem is getting worse, and solving the problem present cost with delay benefits. And then you have to explain. And it's very difficult to explain to the leaders, to the politicians, and to the administratives in the hospital. So, but keep it in your mind. Next. Terror doesn't know any boundaries. No one is immune. Even you receive a corona virus immunization. Terror, we didn't develop yet any injection to stop terror. And as you can see, nobody's immune. It's all over the world. Next. When you speak about terror, the mechanism of injury is the primary blast injury, the shock wave, secondary blast injury, penetrating, tertiary blast injury, displacement of the victims, and quaternary blast injury, it's burns, like was mentioned in the previous lecture. Next. Speaking about primary blast injury, we should remember that it's a rapid spread of shock wave. It's injury to gas-containing organs like lung, the ears, the bowel. Blast lung injury, 18% are survivors, and the tympanic membrane rupture occurred in 22% of the survivors. Remember, when you are doing an X-ray, the classic appearance in chest X-ray, what we call the butterfly appearance. Next. Another important fact in primary blast injury, that primary blast injury kills while leaving no external trace of injury. People are really pristine from outside, but from inside, they are totally destroyed, totally. So when you're doing the triage, you have to keep it in your mind, and people can even speak with you, but later on, after a couple of minutes, they are dying. Meanwhile, they are speaking. Next. Secondary blast injury, it's, as I said before, penetrating injury caused by shrapnels and debris. 88% of the survivors, and most commonly to the head, 55%. Next. Penetrating shrapnel in suicide bombing, it's usually metal pieces of the explosive. You should remember that the bomber's own body tissue and bone fragment are potential model of infection. You can see here in the right side of the slides, you know, pieces that enter the body, the neck, with aneurysms, with pseudoaneurysms. And the most important is that part of these metal and bony fragments can be with HIV, HBV, rat poisoning conducted bleeding. So remember, patient can bleed, like you will see in further slides. And in some of them, we suspected it was also cyanide. Next. The tertiary blast injury, it's the displacement of the whole body by the blast. The human body is restricted to the acceleration, resistant to the acceleration phase. Injuries are inflicted at the deceleration phase. We can see splenic rupture due to disruption of the short gastric vessels, tumbling of the impact with rigid surface, fractured bones, and closed head injuries. Next. Burns. It's the quaternary blast injury, and it's caused by the tremendous heat generated by the explosion. The temperature of the explosive gas can reach 3,000 degrees Celsius. It's a tremendous heat. Flash burns affect exposed body parts such as the face, neck, and hand. And you can see on this patient a sclerotomy on his right neck. Remember that injuries sustained by victims of suicide bombing attack share the worst of both worlds. We have a lethal combination of blast and penetrating injuries and burns. As I mentioned before, worst of both world, penetrating and blast. This young lady, that's the chest X-ray. Next slide, please. That's her chest X-ray with shrapnels, nails. This is a broken leg, and you see here, and this is the leg. Both legs were affected, and this is what we took out very easily. One tip that I can give you: don't run after shrapnels, especially not in the middle or in the initiation of a the treatment of a blast injury. Later on, maybe you can deal with it, and some of them are disturbing to the patients. We left a lot of these metal pieces in body of our victims, and we didn't touch them for years. And what we are giving them a letter that they have a lot of foreign bodies in order to pass, the magnometer in the airport. And in Israel, you have also magnometers in some places, so that you will be, they will allow you to go through. Next, please. I want to tell you about a young lady that had these injuries, that's the leg. And in the ICU, she received 120 units of blood and clotting factors that was given without any response. The FDA approved in hemophilia the treatment with Novo 7. And in those days, we took it from the shelf to the patient after explanation to the family with all this, what we knew then about this Novo 7. And we gave her one shot and she stopped bleeding. And here she is after 10 years. She was then 16. And then, Hadassah celebrate with her. And here I'm celebrating with her in her wedding. And then later on, she gave birth in Hadassah. And now she has another 2 babies. So overall, she has 3 kids. We looked, I don't want to give you a lot of, next slide, please. We looked on our numbers, and you see that in terrorist versus conventional trauma, the ages are in terrorist higher, injury severity score very high. Everything was really in terror bombing, very, very significant. Mortality, everything was really highly significant. Next. We were partly involved in the attack in the Westgate in Nairobi, in Kenya. There was 200 people wounded, 72 deaths, pre-hospital response affected by large civilian bystander efforts, inability to establish scene control. Some hospitals were overwhelmed with patients. Largest hospital, Kenyatta National Hospital, received no victims. Triage area was 1 kilometer from the scene, and ambulances were really scattered. I put it in order that you will, when the first speaker spoke about, that you have to prepare yourself. So that's something that was not learned in 2013 in Kenya, and they have some really mistakes that were then later on were totally, they changed it and they learned a lot, and I hope they will not ever have another such event, but I think they are now much, much more ready. Next. Something that we learned, and we called it the accordion in hospital accordion approach. You know, you receive the patient, the surgeon in charge, he have to deliver the patient to the admitting area, trauma room, OR, then he is receiving notification from all these sources. Again, reassessment, continue evaluation, definitive treatment later on, surgeon in charge, meaning the surgeon in charge should be the experienced guy with a lot of knowledge, with a lot of experience that can do all this activity, and as we mentioned, the accordion approach. Next. As you can see, the triage of the victims in the entrance of the ED should be done by the surgeon in charge. If those hemodynamics, instability, respiratory distress, penetrating end and torso, or more than 4 body regions injured, if it's positive, immediately to the trauma unit, from the trauma unit, ICU, OR, imaging, and then later on to the floor. Next. That's another work that we did on scene triage. We looked on penetrating head wounds, injury to 4, as I mentioned before, to 4 or more body regions. It's predictor of blast lung injury, was published in the Annal of Surgery. And another one that was really penetrating torso wounds and injury to 4 or more body regions. It's predictor of intra-abdominal injury that require laparotomy. That helps us to do our triage on entrance to the hospital. Something that I want to mention also, it's what we developed during all these events. Is I called it this, I will not speak about tourniquet now. Tourniquet, it's obvious with all the campaign of Stop the Bleeding by the American College of Surgeons. But I want to speak a little bit about the Foley catheter. And in our experience, for example, in this woman, 21-year-old woman, injured from multiple shrapnels inside the Hebrew University Mans Corpus cafeteria, and she suffered from profuse bleeding from her left upper chest and shoulder region. It's in red. We couldn't ventilate her because all the air was escaped from these wounds. So what we took Foley catheter, and as you can see there, you can see 5 Foley catheter, and on the chest X-ray you can see them with contrast material. We push them out, we press them out, and like this we stop the running away or the escape of the air during ventilation. And she had also a laparotomy with Bagota bag. She was really in serious condition, and we got away with it. By the way, we opened, you know, by trial and error, one balloon catheter we solved, and then like this, we succeed to release all these 5 balloons. You can see here, you know, on the neck, a nail that was there. It was another problem of airway, but we managed to deal with it also. And now that's she, after 3 months in the ICU. Remember, it's a demanding and it's distracting the hospital activity, and you need, as was mentioned, ORs, you need multidisciplinary teams, and that's one example of this young lady 3 months later. And then next slide, And then you can see here, she was paralyzed also, paraplegic, and but she's doing all this activity, and she's really having life. Now, another thing is, you can see this innocent, next slide, please. Innocent penetrating injury to the left shoulder. And we did an X-ray, and in the X-ray, we saw this shrapnel. Next slide, we did a CT scan. Next, okay. And in the CT scan, next, we saw the shrapnel, and it didn't touch the aorta, not the superior vena cava, and it was surrounded by these two big vessels. But what we suspected, there is a hole in the esophagus. We gave him contrast material, and you can see here the extravasation of the contrast material. Later on, we operate him and we fix the hole, and then he left the hospital healthy. Next slide. So I want to really conclude my lecture and to say that terrorism remains a global threat. Leadership is the key to success. Preparation is essential. Time work for you in planning, time work against you in crisis. Integrate administrative tools, clinical care, and public health. Utilize existing resources. And the goal, as I mentioned in my beginning, the goal is saving life. Next slide. Remember that personnel and resources recruitment, frequent reassessment and consultations. And I think that's another very important thing. Absolute personal commitment from all team members. It's destructive. It distracts your life, your personal life, distracts your emotional life. It's really something that you really take home with you. You cannot leave the hospital. You are coming again and again and again. And it's a commitment. Next slide, please. So as I told you, Jerusalem and Israel is a very nice country. You can see for all the religious party, as was mentioned in the beginning, in the introduction of Asia, etc. That's our parliament and the West Wall. So you are welcome to see us and to be with us in the most of the days is a peaceful country. Thank you.